This segment of Delmarva Life is brought to you by Peninsula Home Care.
Chronic disease, if you've ever had to deal with it, you already know it can make you feel absolutely miserable. Thing is, being sick or suffering from a chronic illness can affect more than just your body.
It can result in an onslaught of emotional, financial, and social needs, but you don't have to go through that alone. That's where social workers can step in and help. So wouldn't it make sense to have social workers in places where health services are already delivered? It'd make life a whole bunch easier.
Now, search no more. They're already in place. They're known as medical social workers. And to learn more about them, we've brought in Michelle Warren, a medical social worker for Peninsula Home Care. Thank you so much for joining us this afternoon.
Sure.
So we've all heard about social workers. What is a medical social worker?
A medical social worker is a social worker who works in a healthcare setting.
This is pretty important when it comes to trying to make everything work right between healthcare and the patient, right?
Yes.
What do you do to try to make that continuum work well?
We work closely with the nurses and the doctors that provide the medical services to the patients, and we will go out and we'll do a psychosocial assessment. We'll look at all of the factors that are happening in the patient's life, whether it be financial or the medical issues that are going on, and we try to link them to resources in the community that will help benefit both them and the family.
Pretty important, isn't it?
Yes.
When it comes to patient care, to link all those things. So you must really be in touch with the resources in the community.
It is. It's very important that we know what resources there are in the community so that we can help link our patients and our families to the best quality of care.
So do you have to deal with the more traumatic injuries, assaults, things like that?
Not so much in home care and
Right.
home health, but that is certainly an avenue that social workers deal with.
Right. So you're prepared for that. You have the connections that you need to be able to provide for that.
Absolutely.
What about, when a patient gets a terminal diagnosis? What's that like?
It's obviously very traumatic for the family, the patient. So we help to provide some short-term counseling for the families as well as the patient to help them to deal with the illness and the burdens that come along with that.
Right. So I'm going to make a guess here that you really enjoy what you do.
I do.
Why?
I like helping people, and I like to be able to make a difference.
And no two, I guess, patients or situations are alike, are they?
They are not. They're all very different, and it's great to be able to help families and patients and be able to see the difference that we are making.
What would you say to someone who's watching, who is a patient, who is suffering through something right now? What would you say to them to build up their hope?
Well, that there are people out there that can help, and that we are able to look at providing some connections to them if they need counseling or just someone to talk to, because sometimes people just need to vent.
Yeah.
Don't give up, just keep going.
That's right.
Nice to have that support.
Thank you so
so
much.
much,
Thank you.
Michelle. Very interesting. And to read more about Peninsula Home Care, go to our website, delmarvalife.com.